I walked through the exhibit hall on the first day, and I was amazed the spillover crowds in some of the booths. And I think it was because there was an exchange of information. You know, there was lectures going on within the booths, different obviously from the science that goes on upstairs. It was really clear that there's a wonderful partnership and a collaboration, and I actually believe that's one of the things that has made interventional radiology so strong, that we understand that innovation isn't really just going to occur in a vacuum, that's for sure, and it really relies on collaboration between the industry partners.
You know, we're seeing so much come out of industry now in terms of novelty. In the past, it has oftentimes been about better mousetraps, and it's been essential in moving our field forward. However, now when you walk through the booths, you see imaging companies, you see software companies, you see educational companies. I mean, it's incredible how that has expanded while still staying true to our cores. Creativity comes both ways, right? It's almost like bench research, where it's bench to bedside, back to bench. It's the same with industry. You know, we can't do it without industry, and industry can't do it without our input. So, I mean, that by definition is a partnership. And it's a stronger partnership than it's been in the past, in part because of changes with regulations. You know, everything's a little bit tighter, everything needs to be pared down a little bit. So it's essential that neither we nor our industry partners go off on an offshoot that's not going to go anywhere. So I think there are several things about innovation that make it inherent to our field. One is that we're heavily device and technology dependent. And if we don't innovate, we go away, right? So you always have to take that next step, because who wants to be treated the same way we were being treated 20 years ago, 10 years ago, 2 years ago? The other thing, that it's not just all about devices though, right? It's about taking what we know, our skill set, and translating it in two ways, either into other parts of the body or other pathologies. There are so many different ways that we can move with our basic skill set that it's almost endless. It's almost endless what we can do at this point in time.
And patients expect innovation. I mean, you know, patients don't go to the doctor without information, right? Patients always come to the doctor with some sort of sense of information. Maybe they've tried to diagnose themselves online. If at a minimum they've looked up some treatments online, and they are looking for something different. You know, they're really truly looking to make sure that some impact is going to be fine-tuned to specifically what they need, and all of that requires innovation. I would like to think that there's very few procedures that an IR will take on and innovate that the patient wouldn't absolutely agree is precisely what needs to be innovated. And I think there's just no question that the synergies that we have in terms of what IR innovates is completely what a patient wants and a patient needs. The Society of Interventional Radiology is committed to ensuring that as many people as possible hear the story of interventional radiology. And we're prepared to tell it as a story. We believe it really is a story. We believe it's a thread. It's a conversation about how interventional radiologists change patient lives on a daily basis. The efforts of the Society are instrumental in helping that happen. The physicians on a day-to-day basis are interacting with patients and they're working at home, but in order to reach the people that really need to hear it, the story from the Society's perspective has to be retold. And retold in such a way that it's understandable. And you know, it used to be a day and time when I believe people sort of didn't think they could explain very well what interventional radiology does, because you get to the level of explaining the procedure. But the reality is patients, I think, are a lot more sophisticated and a lot more savvy, and so the messages that we can tell them are a little bit more understood. And I think that the way that we can tell what we're accomplishing is truly in a language that anyone can understand.
There's not a physician who's training now who doesn't understand the importance of interventional radiology.
And I think the other issue too is that it's very clear that in order to make a strong profession that is in medicine, it most certainly needs to be strongly grounded in science. The foundation is what really enhances that mission. So by having a clear mandate on what the Society is trying to accomplish, to engage its members, to empower its members, to work on behalf of its members, having a foundation that sits there that both provides vitally important resources to young residents or really anyone doing research at any point in their career is an essential piece. And quite frankly, the foundation is a wonderful, wonderful place for people who just truly want to support the profession to provide donations. And I think that oftentimes we forget that the joy of philanthropy is in the giving. And the foundation actually has benefited from many, many people who've done exactly that, that they are here to give back to an organization that has somehow impacted their lives. And to see that working together to truly accomplish great things is the goal of both of the organizations together.